What if you could see your hair transplant results before the surgery? Sounds unbelievable, but nowadays this is true and possible. You can exactly see how your hairline is going to look like, what kind of hairline suits your face, what kind of results you can expect at 6 months, 9 months or 1 year. The truth is that every person's hair roots are different, the skin is different. It's just like a fingerprint. There is a lot of individual variation in terms of graft and its quality. Many a times you don't undergo all those things and later on you regret the kind of hairs you got after the transplant. But with the changing times and a lot of advancements in artificial intelligence and machine learning, you can actually preview or get a peek into the kind of results your surgery is going to provide you. So let us discuss how AI and ML and algorithms, they actually predict your hair transplant results. So let's straight away dive deep down into this complex but fascinating topic of AI and ML, especially its use in hair transplant. So AI and ML are not the same thing. AI, artificial intelligence, is sort of refined system which is going to predict it, and it's a full-blown system which is now in place, whereas machine learning is the prequel of AI and its system, where the machine or the computers are learning from the data which is fed to it. So ML is the first stage, which is like processed for a lot of time. It studies your previous results of a particular clinic and sees the kind of result, the hairline and the density which a person got with that many grafts in a particular medical condition or other parameters which are individual to a particular person. Then it churns out a model which is sort of perfect to around 80%, and that is known as artificial intelligence model. After all this, it predicts three things basically: the kind of results you can expect, the number of grafts you are going to have, and based on the algorithm it calculates your cost as well. Now you must be wondering how you can use this for yourself. This is where our PeekAI, which is a trademark system of ours, comes into work. So there are basic 3 steps here. Download and install our Saraswat Hospital with its PeekAI feature. Submit your details through the PeekAI question, and then within 24 to 48 hours get your customized result depending on your hair quality, your willingness to take medical treatment, your preference of your technique. All these results are previewed and reviewed by the ABHRS doctors before the results are actually given out to you. Please hit the like button if this is the first time you have heard about its realistic use of AI in hair transplant practice. So friends, my name is Dr. Satya Saraswat. I am a gold medalist plastic and cosmetic surgeon and a member of ISHRS, FISHRS, ABHRS and IBHRS, and active in this field of hair loss and hair transplant since 2006. Please do subscribe to our channel to know more about such scientific videos and the field of hair loss and hair transplant. So this AI system of ours is best used by males because it has studied a lot of male data and not female data, especially those who are between the age of 25 to 50 years. And this platform is available on both the iOS App Store as well as the Android Store. And the place from where this has come out is Saraswat Hospital, which is a hospital located in Agra, India. If you have any individual query about how to use this system, for whom this is best useful, please write into the comment section below. Please note that this is only for hair transplant result prediction. It is not a treatment protocol or a guide for your hair loss solutions. So why you should use it? Because it supplements your consultation. You get an idea and a reassurance how your things are going to be if they work out for you after your transplant. So whenever you're going to a clinic, and a lot of our patients also used to ask this, that how my hair transplant result is going to look like. This only gave the idea to develop this system. The link for this app is given in the description below. So in the end, I'm going to break a few myths and mistakes which this AI system can also have. So first myth is that AI is going to replace everybody out there. So this is wrong. AI can only supplement the knowledge of the hair transplant doctor. It is not out there to replace them. So it's used best in conjunction with a detailed discussion and a consultation with your hair transplant doctor. And the second myth is that it's always 100% correct. So this is again wrong. AI is known to be wrong many a times, and we are going to discuss the conditions in which this can be wrong. Suffice would be to say that around 80% of our results or the predictions are coming out true. And you can see, before we delve into the reason why it can be wrong, you can see a few before results, predicted AI results, and the actual results of the patient. So you can see there is always some difference between the actual outcome and the predicted outcome, and you can see a couple of these results here. And we will be keeping on discussing these case reports from now onwards. So now coming to the reasons why the actual results may be different from the predicted results by AI. First is your hair quality, the donor side hair quality, which is best assessed by using trichoscopy, which assesses your terminal or anagen hairs, and a ratio of anagen is to catagen hairs, your average thickness of the hairs, average density, and how many grafts are there, what quality of grafts there are. Second reason is some condition of your scalp. So there are few skin conditions which cannot be very accurately diagnosed by AI systems, and if these medical problems, if they are there in your skin, can lead to poor outcomes, especially autoimmune conditions like alopecia areata incognita or lichen planopilaris, pseudopelade of Bock, and many other problems are there, and these have to be assessed. Also, even if you're undergoing a hair transplant, please remember it's not always 100% going to work out for everyone. That's why you see that many of the best of the clinic may have an occasional failure in between. Third thing is the medicines which are prescribed to you post procedure may not suit you or everybody in every case. There may be some genuine allergy to minoxidil. Mostly the allergy is to the preservative propylene glycol and minoxidil, but sometimes there may be a true allergy to minoxidil and it may not suit you and lead to a poorer outcome. Then fourth condition which can lead to poor outcome is stress. There is a condition known as telogen effluvium in which inherent stress, physical, even mental stress, can lead to poor outcome. And last but not the least, it's the way the grafts are handled by the clinic. How a clinic and its entire ecosystem, the staff and the technicians, they are handling the graft at various steps, and what's the survival rate of the grafts in that particular clinic. These are a few things where the results may not be the same as predicted by the artificial intelligence system. If you found out the information given in this video as useful, please share this video with somebody who's going to benefit from them. And if you want to reach out to us and want us to plan out a hair transplant customized for your hair scalp type, your skin type, and your hair condition and your baldness levels, then please reach out to us at the numbers which are given on the screen here. If you want to see one of our recent hair transplant results, you can click the video on the left, and if you want to know the factors which are affecting the survival of the graft, you can click the video on the right.